Hello, my name is Ian Jones. I'm Professor of Cardiovascular Nursing and Associate Dean for Research at Liverpool John Moores University. On World Heart Day, I've been asked to speak to you today to highlight some of the work that we're doing at LGMU and how that work is supporting the Liverpool Centre for Cardiovascular Science. Before I do that, I think it's important that I provide some context so you can understand why this work is so vital. Each year, 170,000 people die of heart and circulatory diseases. That's on average one death every 3 minutes. 336 people every month from the Liverpool City region dying of these conditions. That's a phenomenal amount of people every month that are dying from a preventable disease. One of the reasons that we think the prevalence of these conditions are so high within our area is because the underlying causative factors, the risk factors that cause these conditions, they're also highly prevalent. Risk factors such as high blood pressure, diabetes, high cholesterol, smoking, obesity, poor diet and lack of exercise are all problems for us within our region. So Liverpool John Moores University is committed to a whole range of research studies that help to not only help to prevent the conditions but also to help us to support people who already are living with these conditions. Studies such as we're contributing as development partners to the Liverpool's Global Active Cities Award. This promotes physical activity as a means of enhancing well-being and reducing disease. We're developing and evaluating innovative technological approaches to measuring physiological changes in patients with or at risk of developing heart and circulatory disease. We're attempting to understand the experiences of both patients and their family members, those who are living with heart disease. We're investigating how community pharmacists can support people receiving cardiac-related medications. We're using big data to better understand the impact of a range of clinical interventions and using artificial intelligence to improve the diagnostic accuracy for people with these conditions. We're investigating the effects of dietary changes on risk factor profiles. We're exploring the needs of people with heart failure who are nearing the end of life so that we can improve the care for those patients and their family members and also the support that we offer for those clinicians caring for them. We're measuring blood oxygen levels within the brain to identify the most effective surgical methods for children receiving cardiac surgery. At LGMU, we're proud to be one of the 4 founding members of the Liverpool Centre for Cardiovascular Science, and we are committed to reducing the burden of heart and circulatory diseases in our city region, both now and in the future.